Hello, everyone. This is Patricia with Mental Health Matters, and also you can find me on YouTube at A Slice of Peace with Patricia. Well, congratulations, you have completed your treatment and your bags are packed. You're ready to go back home. Now, some of you may have chosen to go into sober living housing, which is residential, and we highly recommend that for those that have had a long chronic history with alcoholism and also many attempts on their own, and relapse seems to follow. So sober living is an excellent choice. It's usually provided in most towns and cities. And in sober living, you will have a structured routine. You will be living with other men and women that are in sobriety and early recovery. They have transportation and meals and will help you get to meetings and doctor appointments and things like that. So we highly recommend sober living for those that seem to have more of a chronic issue. So think about that. But today's a big day. You're leaving us and you're going home. You feel so much better. You've been now stabilized on your medications, if that's the case, if you're dealing with a dual diagnosis, which is mental health and substance abuse, which is usually what we work with. So you may be on an antidepressant or an anti-anxiety medication, and so you will be asked to check in with your doctor within the first 10 days. And so you have that as your anchor. And I know that there's going to be some apprehension. I know that there is usually some anxiety with leaving facilities. In a way, you've been in a cocoon, and we have walked you through all of the withdrawal and the detox symptoms and getting you more, balanced with that brain through medications. We've educated you on triggers and relapse prevention techniques. We've talked to you about the different programs that are available and highly recommend a 12-step program if that is something that interests you. AA and NA have been around for, as I said before, decades, and we know that you can find a meeting just about anywhere. So this is what it's going to feel like. You're going to be a little nervous leaving, because it feels like you're going out into the world again, and that is normal. So let me just advise you that if you feel a little bit of butterflies here and some anxiety, no worries. That's pretty normal until you get where you're going, whether it's home to your family or perhaps a sober living situation. So within that first week, you can expect some tremors, some maybe mood swings as you're kind of settling back in and adapting to home life, being again with your partner or your children, or being in a brand new sober living situation. That's all very common, and it will all settle itself out. So we have armed you with lots of information, and I'm sure at times it may feel overwhelming. There's a lot for you to do in order for you to stay in recovery and hold on to that beautiful gift of sobriety. So here are some of my recommendations. I would like you to, if you choose a 12-step program, something called 90 and 90 meetings in 90 days. That means a meeting every single day. You get to choose any meeting you want to go to, and there are all kinds of men's groups and women's groups and speaker meetings and daily meetings and meetings on the beach and meetings at 6 a.m. and they go all throughout the day. By this time, you really should be armed with a schedule for your town about where your meetings are, and I would recommend that you take a look at all of them and find ones that really seem to fit you and your lifestyle, but also mostly that you feel a brotherhood, you feel connected there, you feel that people are very like-minded and have gone through a lot of the same life experiences. So you'll choose your meetings, and hopefully you will go every day. We know that a good healthy diet, we know that daily exercise, extremely important in sobriety, because you want to keep all of the mind, body, and spirit all in balance. So that requires for you to really plan your day on almost a weekly basis about what your meals will look like, how often you're going to take that long walk or take a swim or a bike ride. You're going to keep as much stress out of your life as possible. I know that, we all live in a stressful time, particularly now. We're still going through the pandemic. And so, there are certainly life issues that you're going to be confronted with. And speaking of that, I hope that you will circle yourself with what's called a tribe. In that tribe, you will have your doctor, who you will see almost immediately just to check on your medications and see how you're doing. Hopefully, when you attend that first or second meeting, you will find a temporary sponsor. That is someone who's willing to meet with you, go over the program, talk to you about how you're doing and anything that may come up, give you his or her phone number, and you will meet with them on a regular basis. So that's considered a sponsorship. You'll then get into therapy, and I highly recommend everyone attend therapy or counseling at least once a week for the next 6 to 9 months. Now you may say, why? Because we know, as I've said over and over, alcoholism and substance abuse is not the problem. It is simply one of the symptoms of underlying emotional trauma or pain. There are problems that have yet to be surfaced, and they need to come out in counseling. Now, it could be a current situation that you're going through, or it could be something from childhood. But these are all issues that need to be really explored and opened up and healed so that you don't have to drink and use over them. I cannot emphasize enough the importance of counseling. There's couples counseling that will follow, family counseling, and I hope that for the next 6 to 9 months that you really throw yourself into self-discovery and self-awareness and digging at some of those perhaps long-forgotten issues that happened to you growing up and perhaps what you're dealing with in the present day. So you're going to have a therapist or a counselor that will be part of your tribe. You may also want to contact your spiritual advisor, whether that's a priest or a rabbi or a guru or a minister, but hopefully you'll get some spiritual guidance and you'll begin a practice of going deeper into your own spirituality. So add that person to your tribe. You probably have a spouse or a partner, and certainly they're involved, as well as some really good best friends. So when you're getting to have some feelings that you don't identify, you have to make some important decisions. You're going to have a group of people now that you can go to, and you can ask for their advice. So you're never alone in recovery. All right, so you are armed now, you're home. Hopefully you are sleeping well, you're cooking and learning some new recipes, eating healthy, getting those 8 hours of sleep. You're swimming, walking, biking, hiking, running. You're doing something every single day for your body, and you want those endorphins up there, those feel-good feelings. You're going to be hitting your meetings. Some of you may have to go back to work. I highly recommend you go only part-time because, you've been in a hospital. You've got to remember that. And you were pretty sick when you came in. So give yourself some time to recuperate. Most employers are very supportive and they want you to be okay. And you're stable now, but still, you're not fully recovered. That's going to take time. So I hope you'll give yourself, enough time before you jump right back into some of the stressors of a job and daily life like that. So keep that in mind as you're planning out your day. All right, you've done wonderful. Treatment was terrific for you. The cravings are gone. All of the symptoms of drinking and substance abuse are gone. And you're starting to come back to feel like your old self. So this is the beginning. This is only the beginning of recovery. It is not the finish line. There is no finish line. This type of life will be required of you for the rest of your life. Keeping yourself as your number one priority, having structure in your day, having trusted friends, keeping your routine and keeping your sobriety, that beautiful gift, close to your heart. All right, this is Patricia. I will be moving on into your relationships in early recovery, and I've asked Matt, one of our therapists, to come on back and give us some tips. How do we maneuver this brand new feeling and our relationships? I hope this has been helpful. Again, this is Patricia. Congratulations, you did a great job. And I'm sure everyone is really thrilled for you for this new beginning. All right, you can catch me here at Mental Health Matters, as well as A Slice of Peace with Patricia. Stay well, everybody. Thanks for following. Thanks for listening. And share this with any friends who may be thinking about going into treatment for help. We're here, and we want to help you. Take good care, and bye for now. See you next time.